What are some of the things, if you suspect that someone may be being abused or neglected, like what are the signs? What are these people seeing when they go there?
All right. Well, obviously, let's talk about abuse first.
Mm-hmm.
So there's physical abuse, there's emotional abuse, and unfortunately, sometimes sexual abuse. So physical abuse, you can look at the obvious, bruising, you can marks, unexplained doctor's visits where they're having to be taken to the hospital or the doctor. You see signs, and it may be something as simple as broken glasses, torn clothing, broken furniture. So those are the obvious signs. Like when you go and visit your loved one, they're usually a very small room, and if abuse is taking place, other things may get broken, not just the person. So you'll see marks, restraints on wrists. For instance, you can see bruising around the wrist, facial bruising. So those are the obvious ones. Now, when you talk about emotional abuse, some of the things that you'll see is unexplained behavior, like mumbling or thumb sucking, or the caregiver or the employee not wanting to leave the room while you're visiting with your loved one, or belittling language. Say that really fast. So you can hear usually the tone of the voice from the caregiver can be indicative of someone who's abusive. Short tempers. So those are the emotional. Usually it's unexplained behavior. Your loved one appears to be terrified and behaving very differently. And then, of course, you have neglect, which is probably more common. And neglect can involve just, bed sores are the most common. That's just not turning the person, moving them around and doing the things that need to be done on a regular basis. Medication that's missed, dirty bedding, dirty clothes, just a dirty room. Those are all signs of neglect, and that can result in infections, illnesses, and of course, when we talk about sexual abuse, some of the signs are a little more frightening, and that can be, torn underwear, stains or marks on the underwear, unexplained bleeding in the genitals. So, and urinary tract infections. Sometimes if your loved one has frequent UTIs, then it could be possibly that they're being abused. So these are all signs that when you visit with your loved one, you need to be aware of, and you need to be looking for. And obviously they're vulnerable at that age.
Yeah, and so you're describing a spectrum from negligence to criminal culpability.
Correct.
Which